I don't know why I don't hear volume, but it says we're recording and sharing. Normally it talks to us and says that. Well, hopefully everybody can hear me and see the slide. Won't have all the slides that I intended you to see, but that's okay. So,
And if you can't hear, chat in.
yeah, I was gonna say, if you can't hear,
Just let us know.
send a quick chat and I should be able to see it. Okay, welcome to Monarch Family Chiropractic Tuesday night spinal workshop on kids and chiropractic. Was really excited to go through a couple slides just for you to see visuals and see things that correlate to kids at all ages. And with that said, I may flash them in front of me as I'm holding them. And you may see me on the screen here in the recording. You won't see it on the TV, unfortunately. So in talking about kids and chiropractic, we see kids and a lot of people don't know we see kids and why we see kids. And we talk about how kids have such a resilience, right? And so a lot of things that they experience shows up differently. It's not usually aches and pains and, you know, the things adults are being seen for. So it's really important when kids are thriving and going through all those milestones, especially the first 2 to 3 years, their brain is in the biggest sponge mode of absorption of information and learning mode than it will be in the rest of its life. And so we talk about why chiropractic for kids and what does that look like? And, you know, our nervous system is the same. Our, the first thing to develop, like we talk about in a lot of our workshops in utero, is the brain. And from that becomes the spinal cord, right? So that nervous system is in full effect and doing all the other organs, glands, processes of the body after that point. So why wouldn't we support their beautiful, pure structure from the get-go as we do ours from some of the things we've done to ours? So gosh, it's almost like where to begin when we have so many things to share with you about this. So let's see if I can get my slide to at least move. What does it look like to you? Okay. My page looks different, but as long as you see what's on the screen, good. So hopefully you'll see this when I see, gotcha. Okay, wasn't showing up on my end. So we talk about the safety pin, and I want to talk about this process first, and then we're going to go into different ways in which kids are developing, why we're checking them, what we're checking for, how it's different, and how stressors show up in the system that we may not be used to looking for because ours are so different. But the safety pin is a great analogy we use for understanding the brain and how it communicates through that nervous system to our body and how it impacts the development if that cycle isn't functioning clear and if it isn't functioning at 100%. So you have as a starting point, a point where the information goes, right? And then it has to get back up to that brain to tell it what to do. So when we talk about the safety pin, the top of the pin is really the brain, and that is there's an efferent signal that has to pass out of the brain down through the spinal cord out to the part and piece to tell it what it is we need it to do. Right? It's literally the analogy of it's keeping things together. When that pin is closed, it's got that afferent, so the return information from the body back to the brain to say, okay, I did that thing you needed, I did that activity, I did that function, I did that important connecting piece, and here's that information back so that the brain understands what had just happened and it can send another signal. So it's doing that trillions of times a day. It's keeping things connected to each other. And really, you know, our objective is that it is to detect when those subluxations or those interruptions of flow of information and communication are there. So an open pin really doesn't allow for pure communication. Right? It doesn't allow for the signal to come. It may go out. And if that signal is disrupted on the way out, it doesn't get to where it needs to go clear, or the body's working harder to get it there. And how well is that signal coming from what it needed the body to do to tell the brain that it did it? So multiple stressors that come in to play when this is the process that is happening with that open safety pin. But there's really the loop, right? That's the analogy of the pin and how we use it in the body and how that really does actually work that way. And unfortunately, the 4 other slides I had after this didn't save. And so I'm going to talk through pieces of where this loop gets disconnected, right? So factors that play a role in care for kids and for an infant by their chiropractor is many things. And before we get into theirs, I like addressing where that can come from outside before it's even up to their body. And that can be the health of mom and dad, right? So where are they at prior to conception? Where is their body's ability to function and to give what they're giving to develop a kiddo? The chemistry that changes in a body when there's interventions even during pregnancy. That can be pharmaceuticals, that can be other things we eat in our diet, like processed foods. If we're taking pain relievers while we're pregnant, all those things are impactful to the kiddos. And that all passes through, right? That is all passing through the umbilical cord. Physical stress during pregnancy, that obviously plays a role on the stress that can happen, to babe as that process is happening, whether it's being an accident while pregnant, having a trauma to your body, having, multiple ultrasounds is putting impact into the fetus. Any other constraints within utero, that's all putting constraints on them. The emotional component. So, obviously we're raging hormones during that period of time. And so there's a lot of that component that if there is a lot of stress during pregnancy, on top of those emotions we're going through being pregnant and going through that process, it can be that there's, again, a lot of change in chemistry when you have the happy hormones, the sad hormones, all the things going on, let alone pregnancy hormones. So when you think about if there's been a trauma while you're pregnant, whether that's physical or whether it's chemical, right? So we talk about in when you're beyond when you're pregnant and you have a physical trauma or an emotional trauma that could be like a death, a hardship that's happening at the time, all things like that, employment, financial issues, things that could all come up when you're pregnant, when you're thinking about, okay, now I'm in charge of another human's life for the next 18, 20 plus years, right? There's a lot of things that come into play there. So that's all affecting them when we don't necessarily think about that. And then interventions that happen, this is mostly what we talk about with kids. If there has been, a C-section, forceps, Pitocin, so being induced, epidurals, all the different components that get put into possibly the labor and delivery of the baby, that put stressors not just on mom, but on the baby as well. We see a lot of the physical or tension stressors in the spinal cord for babies at the head and the neck with the delivery process. So what creates subluxation, which is, again, this disconnect we're talking about that creates that open safety pin, comes from chemical stressors, comes from emotional stressors, comes from physical stressors, and things that kids need to, there's pieces they need to work through their stages of development. But before we even get to that, when you're doing different stressors, let's just roll through a couple chemical ones. It could be changing in formula if you're either breastfeeding or not breastfeeding, in weaning a baby from mom's milk, toxicity in the household. So I never got more aware of what I was cleaning with until I got my first child, which was my fur child, right? When I got my puppy and thought about him being on the floor and licking things and walking on things. And then the next level of that when we had Xander. So that you're taking out things that are really toxic, even if it's things you put in a bathtub. So many things are full of chemicals and perfumes that just aren't necessary, especially for their young developing body that's still sensitive to things. The other chemistry would be things like, giving them fever reducers or pain relievers when they're battling through a cold or, being exposed to viruses for the first time. Introduction of different foods, antibiotics, vaccines, all those types of things that are impactful to their very, very young developing system. The immune system isn't fully developed when they're born, and neither are a lot of the, respiratory system, circulatory, all those pieces are still developing. Digestive is still very much developing. So their body has to process a lot when we give them different things way differently than when that's already developed. And when you go through different birth processes, so say a baby has a cesarean section, right? And not delivered vaginally or naturally, there's bacteria, good, healthy bacteria that baby doesn't experience and their system doesn't get because they came out a different area of the body. So passing through the canal is really important that they get that healthy bacteria, and not always an option to do something called seeding, which is where you're giving the baby that good bacteria after they've been taken out of the belly. So those are components that can already mess with their digestive system and change their good chemistry because they didn't get the natural good chemistry, if you will, from mom. So all those components can really create subluxation, can create chemical stressors. Again, another reason why we're checking and why kids in chiropractic go so hand in hand with supporting the development and the thriving of the natural process of their system. So emotional stressors can show up with different levels of anxiety, separation, sometimes the processes of, a circumcision, extended stays if they're still challenged, say with breathing or lung stuff or heart stuff, and they're in the NICU for a while. So if there's development stuff where they're not getting to attach bond with mom and dad right away. So we look at different milestones, but there's other signals that I want to talk about with babies and with kids and how they express things. Because I think that's what gets missed and what gets overlooked, that could be something that's their system not thriving the way it should. Therefore, what do we do we're trying to, in a sense, fix a system, but it's because it shows up differently for us. So I would say initially when babies are really young, it would be, do they have issues latching? Is it difficult or painful for them to latch to breastfeed? Did the baby do a lot of arching of their low back or mid back even? How frequent are they making bowel movements in diapers? If that's infrequent, of less than a 1 or 2 in a day's period, that's a concern for the digestion and the processing of the body. Seeing things show up on the skin like eczema, rashes, spitting up really frequently. So again, almost like a reflux. We see it a lot if they're very irritable, cry a lot, can't get comfortable laying on their back. Torticollis is something where you'll see babies where they're just really in this like head tilt, where they really just seem like they only hold their head one way. That's most of the time a lot of stress on the nervous system and the spinal cord as their body was taken out or as they were being delivered. A lot of the rotation that happens then happens right at the very beginning, first moments of life. Or misshapen head, one that doesn't look round, and they can be more oval or really egg-shaped and different. And really when they start delaying in milestones is when I think parents start to go, aha, is there a bigger issue or problem going on here? Like, colicking and reflux and constipation isn't natural and normal. So that's usually their body's way of telling us, hey, something's not functioning and processing right. As a kid gets older, we may see it in the delay of some of those milestones and then show up into a weakened immune system. So when a baby is doing tummy time, that's all really important to develop that neck curve and learning to hold the head up. You aren't born with those good curves we talk about in your spine. When as a patient, those of you that are on the call and know what your curves look like from the side, right? And babies are developing there as they go through those milestones. So it's really important that they go through the tummy time and holding their head up. It's really important they go through that scoot and crawl phase. And the crawling is really when they take those Buddha bellies and drop them to the floor, right? And they're really just doing more of that scoot, and it gives them that low back curve starts to develop. So one of the things we try to discourage a lot is just parents understanding that we all want our kids to just, be awesome at everything, right? And so I think parents tend to want to excel them of like, oh yeah, let's start walking. And it's not important. It is important that we do not rush their process. And if they're not going to stand and walking on their own, there's a reason. Their body is still processing, developing. And when we force that to happen faster, they aren't developing really important curves and really important development piece for the spinal cord and the spine and the structure to hold their bodies upright as they do start to stand and then become just bigger and bigger and heavier and develop that musculature and all the rest of the components of development. They've got to do the holding the head, then the rolling over, and then the sitting, and then going through the crawling and cruising, and then to the walking. So a lot of times parents, when they come in and kids are showing developmental changes or differences, it's because they sped through those stages. So just an important thing to know. So what we may start seeing is that parents are saying, okay, well, they're getting sick all the time. Or, every little thing coming home from daycare into our house, our kids catching everything. So we may see it as like ear, sinus infection, digestive stuff, respiratory stuff, or it starts going into the spectrum things, or kids challenged with focusing, challenged with that attention, challenged with listening. So sensory pieces, or very sensitive to things, right? Things overload and overstimulate them. And that is all part of the nervous system and brain not going through developmental stages at the right pace or at the time it needs to, or bypassing some stages, right? So even in just that example of going from, a sitting or a scoot to parents trying to get them to walk, or kind of forcing that holding and trying to walk them. So that is all the system, in a sense, skipping steps. And then the brain not being able to process its world of what it needs to process and all the stimulation coming in, it's not able to do that as well. So we start to see other challenges. And a lot of times that can go to things that are autoimmune, go to things that are very more behavioral. So they either may lack in developing at certain emotional stage or verbal stage. So there's a process that the kiddos need to go through. When we start to see those behavioral things, that is when I feel like more stuff is being talked about, or a daycare person, a teacher, somebody in education starts noticing differences for them, or areas where they're slower, or areas where they're just challenged and picking things up. So there's a component that, what we start to see when the sensory system and the systems and the brain can communicate better to the body is things like parents say, oh my gosh, they're sleeping so much better. Or there's not this digestion issue with everything. Most of the time they don't feel bad or don't express pain to us. It's more of their mood is very consistent. And when the system is on overload, the kid goes from like seemingly fine, happy as can be, to acting out, or an outburst about seemingly nothing. That's when I see a lot of patients come and ask me questions about their kiddos, is, this thing upset them, and this kid's a really even-keeled kid. So we see changes like that. Their connection and perception of their environment their brain's not processing like it should, and it confuses them. So they act out of really confusion, or fear and uncertainty of what's going on. So that's a way that a lot of times it shows up. It's not necessarily an ache of pain. We might see as kids are developing and getting bigger, though, is postural things, right? So we see coordination and posture improve, but when kids are at a stage where they're not quite into sports, we don't always notice that, or we may just look at a kid and the parents say, oh, they're just the clumsy kid. There's usually a reason for that, right? Developmental pieces there. As they get into school, I love the fact that we should be talking about backpacks, right? We should be talking about what do they look like when they're carrying things. We already talk about posture in the office, right? All the time, almost every visit for many of you. If that's a piece you're addressing as an adult, it is happening with our kids as they're going to school. And it's not uncommon for us to talk to our, parents that have kids in like first and second grade, and their backpacks are heavier, than them. So in general, younger kiddos at that elementary age, their backpack shouldn't be more than 10% of their body weight. And when you get into that junior high school, 15, max 20% of their body weight. So that's a good thing that you can just rule of thumb. If you're on the call and you're listening to this and you have older kiddos, that's something we can be addressing. That's something we can be working on their day-to-day, is how posture will stress the system and put more strain into the brain and the processing of what we're doing, carrying the weight of our bodies and onto that nervous system and function. faster than anything, because there's so much repetition of forward posture, not just in the backpack, but looking down at devices, looking down at their laptop and tablets, looking down just at books and writing it, in school all day. So they do a lot of forward posture already. And now it just starts at a younger age because we have these things in their worlds at a young age that we didn't have when we were little. So there is an article about side effects that I'm going to wrap up with, because we could talk about a gazillion things with kiddos and things we see and things that and additional stressors that are there. But hopefully we touched on ones that happen with early in life, things we may see as kids are developing and hitting those key milestones of crawling, walking, and then getting into school age. There is an awesome 1-year, at least quick screening that we have that talks about gross motor, fine motor, social behavior, language, all of different things that kids should be hitting at certain stages and months. If that's something that interests you, let us know, ask us in the office. We have that here for young parents to be looking at when they're not sure. But really understanding side effects of kids. Doc pulled a great article that I want to read a portion of to you as we kind of wrap this call up. And it was actually done addressing using homeopathic remedies for supporting the system. And so, yes, there's times when the systems are challenged, but we don't have to necessarily run to chemicals that our body doesn't recognize in order to try to change a system or think we're improving a system. So understanding side effects is this 2 paragraphs, and it's talking about how, looking at pharmacology's point of view, there's really no such things as side effects. Drugs simply have effects. We arbitrarily differentiate those effects, and we like from those that we don't like, calling the ones we don't like side effects. Consider for a moment conventional treatment of a child who has a cold. Child's body, like that of an adult, responds to colds and viruses by creating an increased number of white blood cells, and they're what are fighting the virus, right? That is a natural process. That is the body's immune system working like it's supposed to. And some of those white blood cells and viruses die in the battle, right? They die in the immune system protection of us fighting this virus. So the body creates mucus and liquid as the vehicle to discharge this dead matter. So over-the-counter cold medications work by either blocking that mucus formation or drying the mucous membranes or shrinking those nasal capillaries. So once the mucus formation is blocked, then of course, child or adult less likely to be able to discharge those dead viruses and those white blood cells. So the discharge becomes less watery, more sticky, making it difficult to blow out the nose or to cough things up. So in a sense, we are suppressing the natural process that the body is trying to do to get something that it's foreign out of us. So it's predictable that the suppression usually results in more disturbing symptoms, a longer lasting, cold or virus. Instead of having the nasal discharge, the child often will experience then congestion, a congestive headache, various other side effects. It can make you feel dull, drowsy. In some cases for kids, some of the suppression of what happens can create things like behavioral problems, even, fearful states based on what their body's expressing and experiencing. So different than maybe what adults may think with a common cold. These symptoms are not side effects, but they are the direct effects of the drug working against the body's natural healing response. So the decongestant cold medicines, which act by shrinking the swollen capillaries, work, but only temporarily. So although they may effectively eliminate the discharge and clear the breathing passageways, once the medication is stopped, all symptoms usually return and then return worsened than before. And then this is a cycle that I went through as a kid. I had a very healthy young childhood. I believe probably falling a lot off my swing set, different things I did as a kid, doing ballet and gymnastics all the time. Jarring something in my upper neck that I think probably started to create why I was suddenly getting ear infections all the time. But it talks about how when you're going through as parents, you're afraid to stop giving the drugs, fear that the child is going to have symptoms return. And that's what happened. Over time, I was on a round of antibiotic after antibiotic after antibiotic, and that wasn't resolving the ear infection because that wasn't the solution. It was just managing some level of why this fluid couldn't get out, why this bacteria couldn't resolve itself. Over time, though, again, the dosage usually become previously used that would treat the symptoms as now not being as effective, and something stronger is needed. So I think many of us see that even as adults take medications, the longer you take them, the body becomes more immune to it, gets used to it, and the dosage gets up to the next medical checkup, right? Or physical or blood labs saying, oh, this is not doing the trick anymore. This is not meeting the needs it was doing for the body once before. So worsening of the symptoms after the medication is stopped, called the rebound effect, is not a side effect. It is the body trying to heal itself, which it will do more effectively when we stop trying to suppress its natural efforts. So since symptoms are an important defense to the body, it makes sense to use methods that support this defense rather than those that inhibit it. So that's where this was a article out of a homeopathic book, talking about homeopathy, is one such method. What we do is one such method to reduce that interference so the brain body connection and all those organ systems can function at their capacity. So I think that was a great article in the way we look at side effects, good or bad. When we talk about kids and chiropractic, one of the beautiful side effects is symptoms go away, bodies start thriving, nervous systems start communicating better. Things like digestive gets improved, coordination for kids gets better, their ability to focus. I mean, it's that way for adults, but with kids, it's really easy to see a lot quicker. Their behavior and their concentration and their mood, because of the better connection to brain and body, and the perception of their environment isn't so scary. For adults, we have other ways we process and deal with things. With kids, it's very much like you see them go into fear mode because they don't know different, right? They don't know how to kind of, I guess, hide behind that like we learn to do as an adult. So when you see those kind of challenges in kids, I think it's really important to recognize that could be where it's coming from, is stress in their system, and how to support their growth and development in the best way possible. Obviously for us, the more we feel, the more natural way you can do that, the better. Their body doesn't need any more outside chemistry. It just needs no interference. So I think that, I don't think the other slide made it after this. I'm going to check here, but in wrapping up, yeah, it didn't make it in there. Thinking of anybody that anybody in your family, anybody that, what could that be presenting as to them now may not have been what it presented to them as when they were little, or at a different stage of development. So worth a conversation, worth why we talk about chiropractic with kids and why we love checking. We got just got Doc got to see maybe 1 week old, maybe if that. Oh, 3 weeks. Yeah, today. Came in after mom got home from delivery, and we have a couple patients this week in delivery. One today or tomorrow is the due date, right? So we're excited to be seeing our mamas and our new ones in the office here in this next week. So if there's somebody that are thinking of, or someone whose kid is challenged in this, maybe this is information that you can share. And a lot of those things I just shared in the workshop are things that are great in handouts that we have at the office. So if that's information that's helpful for you to feel like you can pass on to somebody, know that we have that here and that's available to share chiropractic and why chiropractic for kids is helpful with parents and the people raising kiddos. So thank you for being with us today. Thank you for indulging the fact that I didn't have PowerPoints for any of that data. And if you want it, ask for us, email the girls and we'll email them to you. So I'm going to stop the recording. Thank you for joining us for Tuesday workshop with kids in chiropractic. Oh, I might have just done the wrong button. Oh, sorry, guys. Oh, here I am not being able to get to the right